This is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum, dean of Sama Institute of Health. We are still doing our sessions in patient safety. This is topic one. What is what is patient safety? We divided this session into two presentations, so we finished the first one. Now we're going to continue on the same session. As we mentioned, the objective to describe causes of errors and medical errors, discuss the burden of medical error, defines the discipline of patient safety and its role in minimizing the incidence and impact of adverse event, describes the lesson learned from other industries. In the previous session, we discussed the causes of error, the role of human factors, and the burden of these problem in terms of morbidity, mortality, and economic cost. So most healthcare professionals are drawn to healthcare out of desire, and they are there to help others. They go through intense training and are carefully screened for their position. So, given the nature of typical healthcare provider and the comprehensive training he or she receive, this raises the question: why uh, they commit mistake? Why they commit errors? Why error happen during their practice? The practice of modern medicine involved numerous drug and highly technological equipment. In one teaching hospital, they reported that every day they are 4,000 hand off. So this come to a total of 1.6 million per year. And as we know, handoff and transition of care is an area of high risk, and it increases the risk to the patient and associated with a lot of error unless it is handled well. Provider might not be prepared to work as well-trained integrated team, miscommunication at every turn. Diagnosis and treating patient is incredibly complex and often performed under time pressure and with insufficient information. According to Society to Improve Diagnosis in Medicine, diagnosis errors like wrong diagnosis, misdiagnosis, delayed medical diagnosis occur in up to 15% of cases. For frontline providers, there are always new medications, new technologies, new procedures, new research finding. There are more than 10,000 type of medical device available today. All these increases the complexity of medicine. So let us learn what is the lesson learned from system failure from other industry. In large in big industries and like aviation, like nuclear plant, when they did the accident analysis, accidents are caused by multiple factors, not single isolated factors. Factors could be related individual situation factors, workplace conditions, latent organization factors, and also management decisions are commonly involved. Analysis of these disasters also showed that the complex the organization, the greater potential for a larger number of system errors. Turner, a psychologist in 1970, was the first to appreciate that tracing the chain of event was critical to understanding the underlying causes of an accident. James Reason, who worked in cognitive theory of latent and active errors and risk associated with organization accident, reasons he pointed that latent human factor were more significant than technological factors. So investigations in high risk industry like nuclear plant, what happened in Chernobyl, and also what happened to Challenger shuttle crash, they found that there was prevailing culture in organization that they tolerated violation. So tolerance to violation was a rule, and that people, they violate rules, they violate procedures, and this becomes a norm. So there are latent system factor contributed to underlying accident and incidents. James Reason designed what we call a Swiss cheese model. In Swiss cheese, there is a hole, and there are multiple Swiss cheese, and each there is a hole, and so error they happen in each block, and when the condition becomes suitable, then all these protective measures they fail, and then error will happen. One of the layer, what we call latent factors, this is related to the organization process. It depends on the workload. When people do handwriting which is not clear or legible, prescription that is not legible, management decision like staffing level, culture of the staff, lack of support for new or frontline providers. Also, they recognize error producing factors. So environment which is very busy world, or there are a lot of interruption. Team, when the team lack appropriate team dynamic and appropriate team communication and lack of supervision. Individual with limited knowledge, when you have frontliner who are not well supervised. The task itself, the repetition of the task, poor medication chart design, or subtasks like if you get a surgical patient in a medical floor, or if you get patient with heart failure in a surgical floor. So these people are not familiar with that task. And also patient complexity and communication difficulty, and if patients speak a different language, uh, active failure, this is related to slips and lapse and violation, and all these will line together to produce system failure. History of patient safety and origin of blame culture. There is a blame culture in healthcare. Why do we blame? Person approach, and we need to differentiate between person and system approach. So if a patient receive a wrong medication and suffer subsequent allergic reaction, we look for individual nurse or doctor or pharmacist or even a student uh, who ordered, dispense or administer the wrong drug, and blame that person for the patient condition. Individuals who are identified as responsible are also shamed. So we blame them and we shame them. So the person responsible may receive remedial training, disciplinary action, or told never do it again. We know that simply insisting that healthcare worker try harder does not work. Policy and procedure may also be changed to help health worker avoid allergic reaction. Uh, However, the focus is still on the individual staff member rather than on the whole system, which is failing. The system is failing to protect the patient and prevent of administration of wrong medication. It is human nature that we want to blame someone. Uh, it is that far more emotional satisfying for everyone involved in investigation of an incident if we can find someone to blame. And it also can send a strong message to the others. If you're gonna do it, we're gonna shame you, we're gonna blame you, we're gonna discipline you. And it also it send a message to the victim, the patient who was injured, that we find the person who violated you and we punish him. Pero, 1984, was the first to write about the need to stop pointing finger at individual. He observed that 60 to 80% of system failure were responsible for operator error. And system failure could be related to socio-technical breakdown, and related to design that does not suit human factor for both individual and at institutional level. Although system factor are the major source of error, but this doesn't mean that professionals are not accountable. If they know and if they violate, if they deviate, then they are accountable for their action. And James Reason pointed that there are different kinds of violation. Violation is when you do the wrong thing intentionally, when you violate a process or a protocol. And he defined that there are different kinds, like routine violation, when someone just he doesn't do the hand hygiene because he feel he is too busy, so this become a routine violation. And also when we do the hand off sign out and we don't do it properly, this might become part of the routine violation. There is also optimizing violation when a senior staff assign student or a frontline provider to do the work without supervision and mentoring. And some people they call what we mention as necessary violation, that they feel that they are under time pressure and they skip important steps like in patient administration or in prescription, or a midwife who does not document the different stages of labor. We need to create a model of patient safety. It's about those who work in healthcare system, about their training, their competency, communication style, and the culture prevailing in that organization. Those who receive care, uh, who are vulnerable, um, we need to engage them, and also we need to look at the infrastructure of the system, and also we need a method of feedback and continuous improvement. So we, as healthcare provider, we should understand the multiple factors involved in failure. We try to avoid shaming and blaming culture, practice evidence-based care, maintain continuity of care for our patient, and we need to implement extra caution as a transitional zone. Be aware of the importance of self-care, and we're going to discuss that in another session. And we have to act ethically every time. For the junior staff or frontliner provider or anyone, always ask question about other part of health care system. Ask for information about the hospital or clinic process that are in place to identify adverse event. So take home, as we mentioned before, medical errors are common. Unsafe care will lead to significant patient harm. 10 to 15% of hospitalized patients are injured during the care process. Economic burden is huge. Error happen due to system factor and human factors. We need to redesign the system that accommodate for these factors, and we need to avoid shame and blame culture. And thank you.